Unpleasant body odor is an issue that affects people of all ages, but it's a particular concern for seniors. While body odor is often associated with adolescence and young adulthood, the reality is that as individuals age, they may encounter more complex challenges when it comes to maintaining freshness and hygiene. However, the good news is that in most cases, this issue can be resolved with simple changes to daily routines and a little bit of attention to specific areas of the body. In fact, research indicates that nearly 99% of body odor in seniors comes from a single, often overlooked spot. And by focusing on this area and following a few essential hygiene practices, seniors can keep unpleasant odors at bay and enjoy a more comfortable and dignified lifestyle. When it comes to body odor, there is a common misconception that it's an inevitable part of growing older. However, it doesn't have to be. Many seniors are unaware that a small, simple change in how they care for their bodies can have a significant impact on reducing or eliminating odor. By understanding the primary causes of unpleasant smells and identifying the key areas that need attention, seniors and caregivers alike can effectively manage hygiene and prevent odors from becoming a source of discomfort. This video will focus on the one spot that is often the source of the majority of body odor in older adults and provide practical, easy-to-follow advice on how to wash and care for this area properly. What causes unpleasant odor in seniors? Before delving into the specifics of which area needs to be cleaned, it's essential to first understand why odor tends to be more prevalent in seniors. Several factors contribute to the development of unpleasant body odor in older adults. 1. Changes in skin structure. As people age, their skin naturally loses some of its elasticity and moisture, becoming thinner and more fragile. The production of oils and sweat also decreases, leading to an environment where bacteria can thrive more easily, resulting in body odor. 2. Decreased mobility. For many seniors, mobility becomes a challenge over time. This makes it more difficult to reach certain parts of the body and maintain a thorough hygiene routine. Areas where sweat and moisture can accumulate may be left neglected, creating the perfect conditions for unpleasant smells to develop. 3. Medications and health conditions. Seniors often take medications for various chronic health conditions, and these medications can sometimes interfere with the body's natural processes. Certain medications can increase perspiration, alter the scent of sweat, or even reduce the body's ability to fight off bacteria that contribute to odor. 4. Dietary habits. The foods we eat can have a direct impact on the way our bodies smell. Diets that are rich in spices, garlic, onions, or alcohol can lead to stronger odors. Additionally, seniors who have underlying health conditions, such as diabetes or kidney problems, may experience changes in their body odor that are tied to their illness. 5. Incontinence and moisture. One of the most common concerns for seniors is incontinence, which can lead to the accumulation of moisture in certain areas of the body. This moisture, combined with bacteria, can produce a foul odor, especially if the affected areas are not regularly cleaned. While these factors can contribute to body odor, there is one particular spot on the body that tends to be the main culprit when it comes to unpleasant smells: the groin and genital area. The key area to address: the groin and genital region. The groin and genital region is the area most commonly associated with body odor in seniors. The reason for this is simple. This part of the body contains several skin folds, and it's often a location where sweat and moisture accumulate. These conditions create an environment that's ideal for bacteria and fungi to thrive, which in turn leads to unpleasant odors. In addition, seniors often face mobility challenges, making it more difficult to clean and maintain proper hygiene in this region. In some cases, the skin may become irritated, making it even harder to effectively clean the area. If left unaddressed, These factors can lead to persistent odors that can be both embarrassing and uncomfortable. While this may seem like an unpleasant reality, it's important to know that a little extra attention to cleaning the groin and genital area can resolve the issue. Proper hygiene, along with a few easy-to-follow steps, can significantly reduce or eliminate odors and ensure that seniors feel fresh, clean, and confident. How to wash properly. A step-by-step guide. To properly manage body odor in the groin and genital area, a consistent and thorough hygiene routine is key. Here's how seniors can keep this area clean and free from odor. 1. Use mild, hypoallergenic soap. When cleaning the genital region, it's important to choose the right soap. Avoid harsh soaps or those with strong fragrances, as they can irritate the skin and even worsen the odor. Look for mild, unscented, hypoallergenic soaps that are specifically designed for sensitive skin. These will clean effectively without causing unnecessary irritation. 2. Clean daily and thoroughly. A daily cleaning routine is essential to prevent the buildup of sweat, bacteria, and moisture in the groin area. Use lukewarm water and gently lather the soap, making sure to clean all folds of skin, including areas between the thighs, under the scrotum, for men, and the labial folds, for women. It's crucial to always clean the area front to back to prevent the spread of bacteria from the anus to the urethra. Seniors who have trouble reaching these areas due to limited mobility may find it helpful to use a long-handled sponge or a bidet attachment to aid in cleaning. Wet wipes that are designed for sensitive skin can also be a good alternative when washing with soap and water is not an option. 3. Dry the area completely. After washing, it's vital to thoroughly dry the groin area. Bacteria and fungi thrive in moist environments, so leaving the area damp can contribute to persistent odor. Use a soft towel to gently pat the area dry, making sure to reach all skin folds. If needed, consider using an absorbent cloth or powder to help keep moisture at bay throughout the day. 4. Consider using antifungal or antibacterial creams. If there's any irritation or if the area remains particularly moist, seniors may benefit from using antifungal or antibacterial creams. These products can help keep bacteria and fungi in check, reducing the chances of odor developing. Be sure to use a product that is specifically designed for sensitive skin and avoid any harsh chemicals. 5. Wear breathable clothing. The clothing you wear can also impact body odor. Tight synthetic fabrics such as polyester trap moisture and heat, which increases sweating and the likelihood of odor. Instead, opt for loose breathable fabrics such as cotton, which allows air to circulate and keeps the skin dry. 6. Change underwear frequently. Changing underwear at least once a day is a simple but effective way to maintain freshness. If incontinence is an issue, it's important to change undergarments more frequently throughout the day to avoid moisture buildup. Look for moisture-wicking underwear that helps draw sweat away from the skin and keeps the area dry. 7. Stay hydrated and maintain a balanced diet. Drinking plenty of water helps keep the body hydrated and supports skin health. Additionally, maintaining a balanced diet can help regulate body odor. Avoiding excessive consumption of strong-smelling foods and alcohol can also reduce the likelihood of unpleasant odors. When to seek medical help. If body odor persists despite proper hygiene, or if there are additional symptoms such as pain, unusual discharge, or irritation, it's important to seek medical advice. Conditions like urinary tract infections, UTIs, yeast infections, and other bacterial or fungal infections can contribute to persistent odor, and these should be treated by a healthcare provider. Seniors with chronic health conditions such as diabetes may also experience changes in body odor that require professional attention. While body odor in seniors can be a challenging issue, it doesn't have to be a permanent one. The majority of unpleasant odors come from the groin and genital region, and by following a consistent hygiene routine that focuses on this area, seniors can maintain a fresh and clean feeling. The solution is simple. Wash daily, dry thoroughly, and pay attention to the fabrics and products used. With these small but essential steps, seniors can ensure they feel comfortable, confident, and odor-free.